Good morning, everybody. Painless with Dr. Jasper
That's right.
and Jeremy Bickers.
Yeah.
And we have a special guest today. And who is the special guest today?
Who is the special guest today? Once.
He's a little shy.
Yeah, he is a little
This
shy.
is the first time he's on the air.
Yeah.
It's Tommy
Tommy
Rodriguez. All right. He's learning how to do this stuff. One day he wants to maybe be a professional DJ. We don't know what he wants to be.
Oh, yeah.
But he's 16 years old and he goes to high school north, right?
Wow.
All right.
Wow.
All right, so let's talk about what we do here. I'm Dr. Gabriele Jasper MD, interventional pain doctor. I do interventional pain, and we have to separate that from regular just pain management. And I always tell people that, especially on this show, because I have my own definition of interventional pain.
Yes, you do.
And my definition is we find the pain generated, we get rid of it. You know, patients come to my office with no MRI. I had 2 patients yesterday with no MRI, and they got a lot of pain, and they want me to get rid of the pain, and I can suspect where the pain is, but it's just a generalized decision that you make a diagnosis based on their appearance, based on where the pain is, and physical examination and history. However, you can't treat it unless you treat it with a shotgun approach, with medicine, with big high dose steroid by mouth, big injections, painkillers, and stuff like that. But it's hard for me to explain to these people. Well, it's not hard for me to explain. It's hard for them to understand that they come to a pain doctor's office and they're not going to have pain relief that day. If they have anything that is wrong with them as far as the spine goes, you don't know what's going on in the spine. You can't just cover it up.
Right.
Especially you have to have a lot of pain. You can't cover it up because something bad could happen. This is how I explain it to them, that if you have a pinched nerve and you take away the pain, you got to realize that the pinched nerve and the pain really protects that nerve. If you have a nerve getting crushed coming out of the spine, like this nerve getting crushed coming out of the spine, you lean or you do something, it's crushing it more. So if you don't feel that pain, you're going to crush it more. You can actually injure that nerve permanently and become paralyzed in that particular nerve distribution.
Right.
Right. So we got to be careful. And some of them get upset. What do you mean you're not going to get my pain away today? I said, well, what you need to do is get the MRI. I got a prescription, and get it right away. We could have the front desk, call stat if you're in that much pain. And they say, okay, all right. And then they say, like, they understand it. And then at the end of the day, they're like, so what are you gonna do about my pain today? So I was like, were you not listening?
Right.
I hate to be a pain in the ass, but I don't want to hurt anybody.
Right.
And you could just hurt somebody. So they go get they get the MRI, they come in with the new MRI, and I diagnose where the pain is. And within this probably a 24-hour period, pain could be totally gone.
Right.
Because you can't just stick needles in and poke and hope.
Yeah.
I call it poking and hoping.
Right.
A lot of doctors do that, or they give them high dose steroids, which at the end of the day is not good because it takes 3-4 days for that to kick in, right? And it's high dose, and you got consequences to that. You can go into acute surenal insufficiency, like Addison's disease, where your body actually produces cortisone.
Right.
And it could turn that system off. And then your rhythm and everything in your body and hormones all go out of whack. So that's not good. And when they come in, and a lot of times that doesn't work because the nerve is so inflamed, because this medication you take by mouth goes all over the body, and a little bit goes actually to where the problem is. So they're still in a lot of pain. Now they come back 3 or 4 days later after high dose of medication of steroids, glucocorticoid steroids, which, cortisone derivatives. And now you got to give them another shot of steroids. That's just too much.
Yeah.
So we try to hold back. I tell them to get in positions that doesn't hurt as much, or there's always a position they can get into. And I discuss that with them, and just stay in that position as much as possible. I've had people stay in that position as much as possible. They get the MRI, they come back, and they got no more pain, because 80% of the people, the pain goes away if they don't overdo it and they get in positions where it doesn't hurt. So people out there right now that are listening, that have pain, one of the best things to do is rest. don't provoke that pain to get worse, because every time you provoke it to get worse or cause the pain to get worse, it's injuring. That's your body telling you, don't do that. You got to listen to the body.
Yeah.
So I do all kinds of stuff. I do, the basic interventional pain stuff with kyphoscoliosis. I treat arthritis with ablation. I do anywhere from what they consider spine surgery, which is kyphoplasties. I do minimally invasive spine surgeries, endoscopic surgeries. I got now, believe it or not, I had a guy from Georgia, a doctor from Georgia, which might be listening. I should have told him to listen. But he called me up. He's been talking to me for about a year. He wants to start some kind of program from Ghana.
Really?
Where people from Ghana who have nowhere to go to get minimally invasive spine surgery, and they have no insurance, but they have money. And they want to come here and pay me to do endoscopic spine surgery on them.
Right.
And I had a patient from New Mexico that heard about me, that has severe spinal stenosis, and they read all about me. They Googled me. They talked to the industry and other doctors that know me, right? And they called and they want to come for me to put in a spacer. Now, spacer is easy to do.
Sure.
If you got any kind of hand-eye coordination, you're not a total.
It's easy for you.
Yeah, it's not a total basket case.
Yeah.
You could do a pretty good job at it because it's not hard, and that's why I don't understand why a lot of other doctors aren't doing it. And I said, listen, if you want. I had a good half-hour telemedicine conversation with them over the phone yesterday, and at one time before that, I told them, I said, listen, I'm going to talk to the people who sell the device and ask them if they know somebody down there that does it. It might be somebody a mile away from your house that could do it, and you don't have to come. And they were like, no, Dr. Jasper, we don't want anybody else. We want to come and see you.
Oh, that's awesome.
It's pretty good for the ego.
Oh, sure, man.
I hate to impose that on
you. Got to be
patients.
feeling good.
I gave them the opportunity. I could find somebody.
Yeah.
But they Googled all over the place. They said they didn't find anybody. And then whoever they did, they didn't think was as good as me. And they were like, no problem. It's only a flight, a short flight, not, probably a 3.5, 4 hour flight.
Sure.
And so that's going to happen.
For something that's going to change your life, for the better.
Yeah.
Yeah, that's nothing.
But anyway, so that's the kind of stuff I do. I do the spacers and everything like that.
Sure.
But I always talk about something very important to me and to the patients, and patients don't realize it. It's this Medicare Advantage. You see, I get so upset when I see actors,
Joe Piscopo,
or I don't know if Joe Piscopo.
He does it.
He
Yeah.
does Medicare Advantage.
Oh yeah, he does.
Well, I'm gonna have to call that guy up.
Yeah.
I am trying to do as much research as I can because we're having so much trouble from the doctors and the patient's point of view.
Right.
And the patients sometimes can't even come and see me because you got to understand what Medicare Advantage is. Whether it's Aetna, United Healthcare, Blue Cross Blue Shield, et cetera, et cetera. They're not Medicare. And I've been doing a little bit of research. What they are, they're the commercial insurance companies that Medicare pays them an average of $1,000 every patient they take away from Medicare. This is what I'm learning.
Wow.
In other words, the Medicare disadvantage, I call it disadvantage, but the advantage programs, they're getting paid by Medicare. Why? Because that's that much less of a burden on Medicare.
Right.
If Medicare doesn't have to pay for these patients. So if you got a patient that's pretty sick and Medicare has to pay $20, $30, $40, $500,000 for heart surgery and all that other stuff, and they pay a Medicare Advantage program $1,000 to take them, that's a win for Medicare.
Sure.
But Medicare is obligated to take you if you want Medicare. Now you go to this Medicare Advantage programs. You know what they are? And this is what I hear on, today you go to YouTube videos and I want everybody out there that doesn't know and has Medicare is thinking, or has Medicare and is thinking about Medicare Advantage, or is thinking about getting Medicare Advantage. I just put in why I would never choose Medicare Advantage, or What's wrong with Medicare Advantage? Just put that in YouTube.
Yeah.
Educate yourself. I was listening to it on the way down here. Tommy was in the car. He was like, he's probably wondering why I'm not, looking at the road and listening to this guy in my 1949 GMC pickup truck with 4 on the floor.
Right.
With no power steering. I'm listening to this guy. It was like unbelievable.
Yeah.
You know what he said it is?
What?
He says it's a different name for HMO. It's an HMO. You know what another name for it is? Management companies.
Yeah.
What does that mean, management companies? It means that they manage your care. You know who manages your care in Medicare?
No.
The doctor and the patient.
Really? All right.
Who
So
manages it.
That's why it's so good.
Because if you have a Medicare Advantage, you don't manage your disadvantage or advantage.
Right.
But I call it manage disadvantage.
Manage disadvantage.
Because they manage it. Now, you go to a doctor, number one, there's a small network of doctors, just like an HMO. When you're in an HMO, no doctors took HMOs. And no doctors take Medicare Advantage.
Right.
I mean, you could. One of the biggest things when I tell these patients, you got to change. Well, I don't pay a dime, doc. I got to pay money with Medicare. That's not true.
Right.
Because you're coming to see me now with a Medicare Advantage program. You have to pay a deductible. Oh, we don't have deductibles. Sorry, maybe they paid an extra $100. You get what you pay for.
Right.
If you have a straight Medicare Advantage, you have a small network. And you know what? One very important thing that this guy says: if you go away to, let's say, Texas to visit your kids that live there, and you get sick,
right,
Medicare Advantage will pay for an emergency. But now you need continued care because something's wrong with your heart. So you got to get a cardiologist. They don't pay for that.
Yeah.
They don't pay for that. Medicare, no matter where you go in the world, will pay for it. You go to Pennsylvania, they pay for it. You go to Texas, you go to California, and you need to stay there because you can't travel and see a doctor. They will pay for it. Here's another argument. They don't get prescription drugs with Medicare, they say, unless you get a Part C, right? You know how much a Part C might cost on the average with Medicare? $100 a month. $100 a month, and they pay for all your medication. It's Part C. You got Part A, Part B. I'm starting to learn this stuff. And in Part C, from what I understand, is your coverage for your medication. You pay $100 a month, give or take, and it covers everything.
Yeah.
This is this is not really coming from me. It's coming from what I just heard on the way down here,
right? Which
is enlightening on what's going on.
Oh yeah.
And
medication, they go up high, and so if all I had to pay was $100 a month,
and another thing is, if you have a devastating illness and you have Medicare,
and
you get some Medicare programs, straight Medicare programs, have a deductible because you got a secondary. Medicare pays 80%. If you buy a secondary, right, which might cost you another couple $100 or another $100, whatever it is, then they pay for the 80%, the 20%. So Medicare pays for 80%, and your secondary, that's my phone, the secondary pays for 20%, right? Now, not necessarily with Medicare Advantage. You got to pay extra for Medicare Advantage to pay for the deductibles and all of that stuff. And if you pay extra, you pay for, remember, you pay more money into your Medicare Advantage, and then you can see doctors at a network.
Right.
I'm bouncing back and forth now from what I remember with this talk on YouTube. But
it had to have been
now. Let's say you have Medicare with a secondary. It don't matter how sick you are; they pay 100%. And when Medicare says we'll pay for this, the secondary has no choice. Medicare sends out, they send the bill out automatically. The docs send the bill out to the secondaries, and it's Medicare secondary. They paid it, no questions asked. You have to go through hoops to get a Medicare Advantage plan because they manage your stuff. They got to. One of the things about it is that they demand most of the time that you have to go see a primary physician in order for you to go see a specialist.
Right.
So now here's somebody with a lot of pain. Somebody's got chest pain. Somebody's got this, and they got it. And they're now, instead of just calling up Dr. Jasper's office because I'm in a lot of pain and making an appointment, when you got Medicare, which you can do, you got to go through a primary. Now you're losing a couple days, you're losing a couple weeks, and you're still in pain. Then you come to the Dr. Jasper's office and he needs an MRI. We got to get it approved. That could take 2 weeks, a month, and they're in pain, right? Medicare, you come to my office, I write a prescription for an MRI, and you can get that MRI that day.
Mm.
You know, why do they call it Medicare Advantage? It has nothing to do with Medicare.
Yeah.
You know, and another thing that they have from what I understand now, they got a class. They have a Medicare Part G. You ever hear Medicare Part G?
No, I've never heard that.
Well, Medicare Part G, you pay a little extra.
Okay.
You know, it's not much, and it covers everything as far as any kind of deductibles. If you happen to have a Medicare program, that you got to pay the deductibles. Like I get, now it's going over my head,
Right.
But compared to oh, here it is. If you pay $200 and something a year for the Part G, from what I remember, $200 and something a year, everything's covered all year. Whereas with Medicare Advantage, they pay only a certain amount, right, for the necessary stuff. Oh, we'll give you you can go to see the eye doctor 2 times a year, and they'll pay for your glasses. You know, so does Medicare if you pay the whatever part that is.
Yeah, yeah.
And but you can go as many times as you have to the eye doctor. You could have you could pay up to like $8,000, $7,000 something a year if something bad happens to you, if you have a Medicare Advantage program. Medicare, just endless. They'll just pay for it. You know, so I mean, please, anybody's, and this is the time you see it on TV every 5 minutes, every 3 minutes, they're trying to sell it. Now, why? Because the guy that's talking he's a broker who sells Medicare secondary insurance. Like if you have Medicare, you want to pay the 20%, you got to get Blue Cross Blue Shield, United Healthcare, Aetna, something like that. And he sells that. The commission for him to sell an out-of-network Blue Cross Blue Shield, not out-of-network, a secondary for Medicare is less commission than if he would sell Medicare Advantage programs.
Right.
So they're giving these brokers an advantage. Remember I said last time on the show that somebody's making a lot of money here.
Right.
And now we figure it out. Who's making a lot of money?
Yeah.
These Medicare Advantage programs are making a lot of money because, number one, they get paid $1,000 more, give or take, by Medicare to take the patient. And they're not paying anything. They're not paying anything. Some patients die before they get treatment. No, right off the bat, they don't have to pay for them anymore.
Right.
And number two, the brokers are getting paid more commission. So they're making money.
Right.
I mean, it's a no-brainer. It's all about the money. That's what it is. It's not about the patient and not about the doctor making decisions. You can't make a decision. The doctor can't make a decision. I have patients now, probably pushing 40 patients that need a specific procedure, but Aetna Medicare says, no, we don't pay for that. We don't pay for that procedure. They make up some reason why, like it's not covered, but they tell the patient that they cover everything Medicare pays. Medicare pays for it, no questions asked. We diagnose it, we take care of the patient, and we send the bill to Medicare, and they pay us. There's no having Medicare making a decision.
Right.
Medicare Advantage, which is a Blue Cross Blue Shield, Aetna, whatever, United Healthcare. Well, that's what I want to say about that.
You know who plays those commercials like all the time? Like when I watch anything on Fox News on their website or app or whatever, it's just all Medicare Advantage in between. It's crazy how much they advertise.
I mean, it's only a matter of time that they're going to go away. But the problem is there's so much money being saved and being made that it's hard to fight people like that.
Yeah.
It's hard to fight them, and it's not the government, but it's these private companies that are making a killing because they're not paying for procedures.
Yeah.
They tell them you can't have it done, and you got to wait. You got to wait. So they wait and they wait, and all the money that they're making, they're probably investing it somewhere and making that money. Then finally
Right.
they pay it. They already made money on it. The percentage of whatever they invested
Dude,
in
that's
is
like that's
what's
crazy.
paying for your health care.
Yeah. That's really crazy.
But well, that's it. That's enough of that crap. But I'm going to mention it almost every time. And
So
I know
what's the date that they have?
December 7th.
December 7th. You have
Yeah,
until
December 7th. And if you figure it out,
Mhm.
you got to really sit down. This is the final thing I want to say about it. You got to sit down with a call like this guy here. You can call him. He's on. We're going to put it on the Facebook page.
Yeah. Yeah.
And you could call somebody who understands, not somebody who's selling, who's making a lot of money on it. That's not who you talk to. If you have a broker that sells Medicare Advantage, stay away from them.
Yeah.
Because you're making a lot more money than they would selling you a secondary for your Medicare.
Right.
That's a known fact. So you got to talk to somebody who understands it and cares about the patient. I mean, he says, I don't sell it anymore. I make less money. Why? Because in his own heart, he knows it's wrong. It's a quote. And he says that he doesn't want patients to come back pissed off at him.
Right.
Say, why would you sell me something like this? I can't even get my procedure done. I can't walk. I got spinal stenosis. Dr. Jasper does something that I can get rid of my pain. I can stand up straighter. My legs will get stronger. I can walk as long as I want. Now I can't walk.
Right.
My legs are weak. I'm leaning over. I got to use a shopping cart. I can't fix them because they are not approving it. Anyway, but sit down and figure out how much it costs. And you can get a zero plan.
Yeah.
I'm going to repeat myself, but maybe it's more organized now. You can get a zero plan where you pay zero money, right? But remember I said you get what you pay for?
Right.
You can't choose your doctors. You got a small network of doctors.
Mm.
That don't take that. Now, if you want to go to more doctors, you got to pay a premium to have added network benefits, which you're going to have higher deductibles. That's how insurance companies are. Higher deductibles, right? And you're going to have copays.
Mm.
But if you get the one that you pay no money, that's the biggest thing. We don't have to pay a dime. Yeah, well, guess what? You ain't getting a procedure.
Right.
That's what you're paying for. Nothing.
That's great.
Yeah. But and like I said, you pay zero, but you go to another state and they don't cover you. They'll cover the emergency room.
So what you're saying is they say, well, you don't have to pay a dime because you're not getting the procedure.
Yeah. Because they're saving money, not doing.
But they just leave that part out.
You can't have that procedure. Because we manage your care and we say no.
That's mental. Wow.
Unbelievable.
I mean,
it's so upsetting to me that this stuff happens because I got so many patients, they come back and then we do these other procedures that they pay for that really doesn't work.
Right.
Okay, doc, can you do this procedure? Yeah, well, I could do it, but it's not going to work as good or it's not going to last as long. So we keep them going until finally people are going to realize it. Another thing, and I said it last time, you see these stupid things on TV. They say, you pay less money for your groceries at the store. What are you kidding me? You get a deduction at your grocery store. We pay for your phone. We pay for this. You can get more. You can get your gas cheaper. What are you kidding me? That doesn't happen. Anyway, there's no medical management company that's going to pay for your food.
Yeah.
It ain't gonna happen. That's just a sales pitch.
Yeah. I'm a marketing guy, so when I see these commercials and I'm watching them, and I'll see like a strip of B-roll that's just senior citizens talking about. They could be talking about anything really, but it fits in with any kind of commercial. So they're saying, "Oh, it's wonderful. It really changed my life." What did? Like it's such a con. It's crazy.
We're talking about this, and this is the podcast, which goes all over the world.
Yeah, yeah.
And I hope if anybody's listening to me outside of this country, please let me know, and let me know what you think about it. And there's people that could be listening that live in where they have national insurance,
Mm,
where they'll have the government pays for it. It's they don't have to pay anything.
yeah.
The government pays for it. But then, like I said, even there you get what you pay for.
Right.
You hear stories about certain countries that if you reach 65 years old, you can't have certain procedures done.
Yeah.
I
Yeah.
operated on a guy 95 years old, had spinal stenosis, that was in a wheelchair. I put the spacer in, all of a sudden he's out of the wheelchair and he's walking with a cane.
That's amazing.
You know, I mean, should I not operate on this guy?
Oh man.
No, you can, and it was with an incision that was less than an inch, and I put it in 10 minutes, and he went home the same day
Right.
with no general anesthesia.
And see, and it's guys like that, man. Before that, they had no quality of life, really. And they've written their future off, because I was in that position, and I had to write my future off in my mind, because they told me this was going to be my life 24/7. But then you get a guy like that, wheelchair, no hope. They come in and see you, and boom, they're walking. That's amazing, Doc.
Yesterday, a patient came in. We put a spacer in a Minuteman
Yeah.
in this patient, and he's got, I think, 2 bad levels. And I put the spacer in him. The guy was, he was leaning forward before. He had a lot of pain. He was an Italian guy, right? I don't know what he was like, from New York, Brooklyn, or some North Jersey. Nice guy. And he's got a young wife. She's probably 15, 20 years younger than him.
Mhm.
And the guy's like 80 something years old. He comes in. He's still got a cane, but he came in. He was so happy. He goes, "Doc," he goes, "I can't believe it." He goes, "I am 80% better." He goes, "Watch me." And he stands up from the chair without holding up, and he just stood up.
Huh.
He says, I had to have help getting up. And he stood up, and he says, "Watch how I walk." And he was walking 10 times better. He's got Parkinson's disease, right? But
Okay.
he's walking, like somebody with Parkinson's disease, but with no pain. He's got no more
Yeah.
pain in his lower back, right? The pain going down his leg is gone, right? And it's only been no, wait a minute. What am I saying? I'm sorry, I didn't mean to yell. No, this guy I didn't put a Minuteman in him. That was the one before. I'll talk about that. This guy had a hernia, not even a herniated disc. But if you looked at his MRI at L4-5, he had this big, looked like a big herniated disc putting pressure on the exiting nerve root, right?
Mm.
We got this on video. You got to see this. I'm going to post that. But when I looked at it on the MRI, it looked a very light color, like kind of like bone color that you see on MRI. I said, that might be a big osteophyte. And then I look at, the nurse read the report, and they said it was an osteophyte.
So that's like a bone growth,
It's
right?
a bone growth coming out of an arthritic joint.
Right.
So I go in there to look at it. I operated on him, and I see this big bone spur, in layman terms. It's osteophyte, big bone spur. That is, it looked like a big glob of iceberg, coming out of it,
Right.
and pushing the nerve right up against the bone. I saw that. So I went in there and I chiseled off a piece, right? I had special scissors that I could cut, because it's not as hard as real bone. It's bony overgrowth, but it's pretty hard. It's got a lot of calcium in it. And I managed to break loose. I had to chop it up because I couldn't get it out of the hole
Right.
that I operate on. I had to break it up a little, and I brought it out, and I see the nerve drop. And not only that nerve, there's 2 nerves. There's one that's an exiting nerve. Here, I can show you. There's an exiting nerve, which is this nerve here. Right? It was right about over here, right? But imagine this over here, putting pressure on this nerve here, right?
Right.
And it was a bony growth coming out of this bone. Let me see. I'm trying to show you. This bone here, right? It was a bony overgrowth pushing up against that nerve, right up against that nerve.
Yeah.
And it was so big that inside you have another nerve right underneath the armpit of this nerve. See that nerve in there?
Huh.
Right under the armpit of this nerve, right in here.
Yeah.
It was putting pressure on that. As soon as I removed it, this nerve dropped down, and that nerve, you could see it right behind it, which is rare.
Right.
And right on the table, a guy says, "My pain is gone," down his leg. But he was so excited I knew he was, and he got it right after the end of the case. He was, his wife and him were so excited, right?
Yeah.
And he had it for a long time, and he was like well into his 80s, late 80s, and nobody wanted to operate on him. One doctor said I could do major surgery and fusion, but he was smart enough to say no. But if he didn't meet me, he might have actually done it because he was suffering.
Right.
But so the big topic was his wife. They were leaving. The guy was shaking me, hugged me, kissed me. His wife said, "Excuse me, doctor, can I ask you a question?" I said, "Sure." He goes, "Do I still have to make his breakfast in the morning?" And I looked at him, and I go, when she wasn't looking.
Right.
And I said, "Of course, at least for another week." Right. And I said, he can't wash the dishes, can't take the garbage out, can't make his bed.
Right.
Right. Can't mop the floor. He can't vacuum. He can't do any of that stuff. Probably a year. So the guy was like, "Doc, you know what? I loved you even before you said that." And she was like, "Doc, are you sure? All he has to do is just cut the bagel and put it into the thing." I said, "Listen, I want him to do the least possible." I said, I got people who sit down on the side of the bed, put their socks on, and they re-herniate.
Right.
Because they had to pay money for this procedure, not all of it.
Yeah.
Because they're Medicare, here we are talking about Medicare now.
Right.
Medicare, certain things they just don't pay enough for. And this particular procedure, now I'm kind of contradicting myself. Well, guess what? Medicare at least pays something.
Yeah.
The Medicare Advantage, but they don't pay anything for that procedure. They won't even let you do it. But anyway, he goes, I said, "Listen, honey," I said, he had to pay a certain amount of money for this procedure. Now, what happens if he re-herniates? He's probably going to make you pay for it.
Right.
So it's probably worth it to you to make his breakfast in the morning. The guy's hugging me. "Hey, Doc, I love the way you talk. You're great. Yeah, whoa, hey." That's one of the good stories of the week.
Oh, that's great.
And the fact that I did the endoscopic surgery on him,
Yeah.
Another thing we're doing overseas is we have a doctor, Dr. Data, who wants me to be involved in, and we talked about, I think, last time, in an international teaching program for endoscopic surgery from India.
Yeah.
Right. So that's up and running, and we're going to plan. We had a successful conference, Cadaver Lab, and we're working on another one coming up.
That's great.
But can you imagine these people coming in from Ghana? In fact, I had a guy that I operated on who was there for another procedure Thursday, and he's from Ghana.
Huh.
Nice guy. And he's had bad spinal stenosis, and I took care of him, and he's very happy. And I told him, I said, "Listen, I have this doctor. He's from Georgia, and we're going to be working." He goes, "I'll come with you, and I'll interpret for you."
That's amazing. I mean, that's a long time coming, though, too. That getting a group like that together, and
Well, I mean, that's his group. That's his group, and I'm happy to help him.
Right.
It's just it just hasn't caught on yet. Endoscopic surgery, and it should catch on. We're not doing as much in certain things like for spinal stenosis because these spacers are working a lot better now. But that's it. Now, what else? We do the spacers for spinal stenosis, endoscopic surgery for mostly like herniated discs that coming out of the spine, putting pressure on the nerves, like I just told you about this guy. You can see a lot of these videos on YouTube if you go under my name.
Yep.
We're gonna post more videos on these procedures. We should do a good video on interspinal spacers with Minuteman and put that on YouTube.
Yeah.
We got to set that up.
Yeah.
Next week, maybe, or the week after.
Okay.
Either Tuesday or Thursday. We'll find out when we have some good ones. We'll take a couple and we'll pick the nicest one.
Yeah.
And it's a great procedure, and we'll even do pre-op on the patient and post-op. See how that goes. But also the ablation, where we have spinal stenosis, sometimes is worse than the arthritis, or it could be just as bad. But you need to treat the spinal stenosis first, or the arthritis isn't going to work. And the way we treat the arthritis is we heat up nerves, we ablate the nerves, we heat them up at 80 degrees Celsius for 90 seconds, and these are the nerves that come out of the joints.
Yeah.
And once you do that, the nerves stop working, and you don't feel the pain from the joints. These are the patients that have a lot of pain in the morning, and they got a lot of pain in the morning, and when they sit down for a long period of time and they stand up, that kind of pain.
Yeah.
And if they sit down for a really long time, the back might start to hurt. Those are your typical. And sometimes they have point tenderness when you put your fingers on the joints in the back.
Yeah. That's the arthritis, you say?
That's the arthritis.
Yeah.
And that's what you had.
That's what I have.
We haven't
yeah.
done that for you. How long?
I need another one. Yeah. Yeah. But but it lasted me for 3 years, I think. Yeah.
Oh, here's another good one that we've been doing. SI joint surgery, sacroiliac joint. We should bring a model in and show people. But especially women, the sacroiliac joint, because of the hormones, when they get pregnant, this pelvis opens up.
Yeah.
All the ligaments get loosened so that the baby could come out of the pelvis. And sometimes they never tighten up. So over the years, they develop arthritis. People who have spine surgery above that level, like in the lumbar spine, even especially when they have a lumbar fused to the sacrum. Now the fulcrum is all in these joints, and they go. Historically, they go, and almost guaranteed that they're going to go. So if you get a patient that had spine surgery 5-10 years ago, that and they have SI joint pain, chances are that's the problem. And it goes along with almost like adjacent disc disease. You fuse a level, like you fuse this level here. The level above is going to go because it takes the brunt of all the pressure of the body moving.
Right.
Then you got to fuse that one, and it keeps going up and up. So guess what? The SI joint goes. It's not the SI joint. The sacroiliac joint goes, and then you got to fuse that. But once you fuse that, it's a very, very simple procedure. It's not a long procedure. It's not invasive. We have minimally invasive sacroiliac joint fusions today, and they're inventing every time you turn around, every 6 months is one less invasive, to where now it's minimally invasive.
Right.
And when you can diagnose somebody truly has that sacroiliac joint pain, it works amazing. And I, my last patient I did, it's like 90% better. And that with the pain that they've had for a long time, these a lot of these patients. And if this patient's listening to me, you get sacroiliac joint injections over and over and over, and they work for a short period of time, you need to fix it. And then that's it. You're done with your sacroiliac joint injections.
Right.
It's fused. It's not going anywhere. It's not moving, because it's the mobility that hurts. Just like when you break your back and you break this part of the back, which is this spine. This is the vertebral body. When you break that, it crunches. When it crunches, it hurts. It's like breaking a bone. Somebody breaks their arm. The arm is hanging and dangling. It's moving. It hurts like hell. And then when they cast it and they set it and cast it, it doesn't hurt anymore.
Yeah.
An hour later, they set it, cast it, pain's gone because it doesn't move. The same as the sacroiliac joint, the same as cracked bones in the vertebral body. As soon as you put, we stick a needle through here, through this little bridge here, which is the pedicle, into the center of the vertebral body, and we pump in this glue. It's an epoxy. They call it cement, and it fills in the cracks, stops it from moving, and the pain goes away. So that's
a pretty amazing procedure too. I've seen, and a lot of you out there listening, if you're senior citizens and you think, oh, I don't know, procedures like this aren't going to work for me. I've seen someone in their, I want to say late 80s, get one from you, and she was feeling fine almost immediately afterwards. So don't wait, just come in.
People who have osteoporosis tend to break their bones
Yeah.
like that. Osteopenia. And if you're out there listening, people should understand if you do have osteoporosis, you need to treat it. Excuse me. You need to treat your osteoporosis because you're at high risk of breaking that bone. You could break any bone, technically.
Right.
So what you do is you get a bone density, and you get the bone density. It tells you if you have osteoporosis or osteopenia, and then you need to act on it. You need to get your primary care physician or endocrinologist or your family doctor, internist, somebody who understands these drugs. And, it might not work the first time because you might be allergic to it or it just makes you feel uncomfortable. There's many, many drugs out there today. And you're talking drugs that maybe one shot a year, one a month. Some of them you could take every day, but you pick the right one. The doctor knows how to pick it based on how you respond.
Yeah.
And it happens mostly in women, postmenopausal. It happens in people who are on chronic steroid, because when you're on 5-10 milligrams of glycocorticoid like prednisone or something, because you have, let's say, lupus, or you had rheumatoid arthritis or some kind of autoimmune disease,
Right.
they put you on that every day. And no, it's good for you in the respect that it calms down the pain, decreases inflammation. However, it also causes osteoporosis. It also causes your immune system to go down. And what happens if your immune system goes down? You have a higher chance of getting colds, more frequently. Your body can't fight the cold off, so you have them for a longer period of time. You have a higher incidence of cancer because your body, the immune system, finds cancer cells and eats them up, right? And also, let's say, for an example, COVID is a classic example. Your body, COVID, it fights it.
Yeah.
Your immune system fights it. So if you're taking steroids, high dose of steroids, it's not going to have the capability to fight that as well. Even vaccines probably don't work that well, because the vaccine is stimulating your immune system to create antibodies against a particular virus. And if it's not working right because you're on high doses, it's a problem. So steroids are good, and they were the miracle drug when it was originally discovered. And this is history, and everybody that had any kind of inflammation, especially arthritis, were taking these drugs, and they were like normal until they realized that their bones were starting to break.
Jesus.
They were doing on higher doses, the better you felt in a short period of time. And then they realized then they realized the complications of it, and they curtailed it.
Right.
And that's the history of steroids. But steroids can save a life. It can save a life by somebody who has like severe pneumonia, a severe inflammatory process in the lung, that antibiotics are just, not fast enough to get rid of it. Antivirals, intubation, whatever it is. And you hit them with some steroids, it calms down the inflammation. All of a sudden, the fluid starts to get less and the inflammation less, and you can breathe. So it's a life-saving. Talking about life-saving, people come in. It just reminded me of a patient that came into my. I was doing the anesthesia for Dr. Skoblar on Thursday. It was a young lady, and maybe 40 years old, who was getting a procedure. And I saw her wrist. I said, "What are you allergic to?" She goes, "Penicillin and epinephrine." I said, "Epinephrine?" I said, "What happens when you take epinephrine?" He goes, "Oh, doctor, it's terrible. I get jittery, and my heart starts to palpitate. It starts to go really fast, right? And my hands shake. What?" And I said, "Don't you realize that's the normal effect of epinephrine?" Like nobody. So all her life she's been saying she's allergic to epinephrine.
Right.
She's not allergic to epinephrine. I told her, I said, "Listen," I said, "if you don't get a rash, have trouble breathing, going to, beginning of anaphylactic shock, type symptoms,
Right.
then you're not allergic to it. If you didn't get a rash and stuff like that. I said, that's a life-saving drug. In other words, somebody has a code who has a heart attack, or like AFib or something. They call a code because a guy or a woman passes out, lands on the floor. They take the pulse. There's no pulse, or it's a rapid pulse. There's not enough heart beating enough to bring oxygen nutrients to the brain, so they pass out. And the next thing goes your heart, and then you die.
Right.
They run a code. One of the things they give you to keep you alive or to reverse it is epinephrine. And I said, imagine you now needing it. God forbid you have a code. And the doctors and the nurses and they're all there. And they say, okay, doctor says, give her some epinephrine. And the nurse says, doc, she's allergic to it. Oh, all right. Let her die. You know what I mean?
Yeah.
Because that's usually the life-saving event right there, is when you give them
That's
epinephrine.
crazy though, going your whole life. And I wonder who told her she was allergic to it. Or is that just her saying
probably
she's
just said
allergic
it
to it?
herself.
Yeah, yeah.
I didn't ask her that, but no doctor's going to tell her, oh, you know what, you're jittery, your heart is palpitating, and then your heart went from 70 to 110
Right.
After I gave you intravenous epinephrine. You're allergic to it. No, I mean, they're not going to say it because that's what it does.
Right.
That's what epinephrine does for a living.
Right.
And that's how it stimulates the heart. Like if your heart is like, stop beating, you give epinephrine, it's going to start beating you.
Right.
You ever see those television shows where the guy stabs them in the heart with a big needle and all of a sudden they come back?
Yeah.
I don't recommend that.
No.
But, there's more
Pulp
modern
Fiction.
ways of doing that.
Pulp Fiction. Yeah.
But that's, so she says, you know what, you're right, doc. I heard that epinephrine, that they, codes. I'm taking that off my allergy list. And what's the other one? I get people saying, I see allergic to Percocet.
That's a good one.
Allergic to Percocet. What does it do to you? Well, doc, it makes me drowsy.
Yeah.
I get this sense of euphoria, and then sometimes I get nauseous if I take too much of it, and I fall asleep.
Right.
I said, well, that's what it does. Does it also get rid of your pain? Oh yeah, it does that too. That's what it does for a living. You're not allergic to it.
Right. I get it. I was a smoker for a long time, and I quit smoking like 12 years ago. And I took those Chantix pills, right? And I was always telling people who were having trouble quitting, I'm like, oh, that's the way to go. And he's, no, I tried. I'm allergic to them, right? And I'm like, oh, well, why? What happened? And they'll be like, oh no, I got all. My temper started raising and all that. I'm like, I think that was nicotine withdrawal. I mean, you're going to go through that, that's part of it. But I think mostly you just didn't want to quit smoking.
Oh yeah, well, smokers, forget it.
Yeah.
People always have an excuse for not smoking.
Oh, I had so many when I was smoking, man.
People like, well, you know what? When I graduate school, I'm going to stop.
Mm.
And then they might have to get married after that. Well, when I
they push the date further out.
But when I get pregnant, I'm going to stop.
Right.
When I have the baby, I'm going to stop.
Yeah.
It's
when
when the sun goes down, I'm going to stop.
Yeah. Like I always used to say to myself, fooling yourself. Well, of course I'm going to have to quit sometime eventually, I'm not going to
kill you.
Yeah.
Yeah. Withdrawals. That's a good topic.
Yeah.
Withdrawals. Yeah. I mean, I went through it myself. I had surgery in the past. And I had a little complication, and I had to be on pain medication. And I was on, pretty high dose of pain medication for not a long period of time, but long enough for me to be physically addicted to it.
Yeah.
I don't have an addictive personality when it comes to alcohol, drugs, but I do have an addictive personality when it comes to working out. I've been working out but good stuff.
Good stuff, yeah.
I got addictive personality where I like to invest my money in depreciating toys.
You like the thrill of a race as well, and
I'm addicted
and stuff
to
like
race
that.
car driving, speed, stuff like that. But I was addicted physically. See, the body when you take pain medications, what it does is um, it's like a chemical reaction. Try to talk in layman terms in the body where if it builds up, and even with alcohol, same thing. You go through withdrawals with alcohol, you stop drinking.
Mm.
With narcotics, which are pain medications, in the body, it usually takes a good 72 hours for it to come out of the system. It depends on how long you've been on it. Well, I remember I was coming off of it, and part of the addiction, you get sweaty, you
Yeah.
get nauseous,
Yeah.
you get severe anxiety, right?
Mm-hmm.
And also the pain that you're covering gets worse.
Right.
Now, I remember coming off, and I was off it for about 48 hours, and my pain got so intense. I was like, I can't come off it. So I took a pain medication again. I was like, oh, thank God the pain went away.
Right.
But everything else went away too. The anxiety, the sweating, the nausea, all of that went away. The itching, all these things, like a junkie when they were going through withdrawals.
Getting a fix, yeah.
And then Michelle, I went to work, and Michelle was like, why did you take another pill? I said, because my pain was so bad. She goes, don't you remember that? And this is good for people to understand. People understand. I knew it too, but you don't think about it.
Not when you're in pain, no.
Yeah. That part of the withdrawals is hyperalgia, which means that your pain that you normally experience gets 10 times worse until the withdrawal's over. 72 hours later, I didn't take a pill. I fought it for 72 hours, and I was done. I felt like a normal person, and the pain really wasn't there anymore. I felt some aching, no pain that you can't tolerate, and it's hard to convince some of these people about that.
Yeah,
that have been on pain medication, and then it also becomes psychological too.
Yeah.
An actual addiction, that psychological addiction where they need treatment.
Right.
And then you have somebody that has an actual addiction disease. They're addicts.
Yeah.
Which is a disease. And that's very hard to treat. That's one of the hardest. It's easier to treat diabetes, they said, than alcoholism. Some schools of thought. Other schools of thought say it's easier to treat alcoholism and drug addiction than it is for diabetes.
Right.
But nevertheless, it needs to be treated. It's a disease.
Yeah.
People who don't understand the disease think that it's just their willpower and not being able to make the right decisions.
Yeah.
I mean, you got people who are smart, educated, and they're. I mean, look what happened to the guy from Friends.
Oh yeah, yeah.
What was his name?
Matthew Perry.
Yeah, I mean he's an addict, and you see some of his interviews. He's like, listen, you don't understand. Who the hell was he being interviewed by? The guy just didn't understand one of those talk
I think
shows.
I just saw that too.
Talk host shows. The guy was like, listen, you need to do this, you need to do that. And it was like, I've done that.
Yeah.
But then it's just it's so powerful that you can't stop.
Yeah.
And when that happens, they say that somebody who's an addict, there's only two endpoints
Right.
to their disease. It's either stop or death.
Yeah.
Some people add in there, incarceration.
Yeah.
That because what happens is you start to do stuff that will put you in jail.
Right.
Like drive drunk and hurt people.
Hurt people.
You
Definitely.
go to jail for that.
Yeah.
It doesn't necessarily mean you can rob a bank. Most people that are drunk and high don't have the energy to rob a bank. And we're laughing over here. I mean, I was always trying to laugh about something, try to make light of this situation, but it's not a laughing matter.
It's gallows, But before I met you, when I was just in so much pain, I was going in for a laminectomy, and they put me in the hospital, and they put me on a morphine drip thing,
After,
during or before and during, and then and then when I left the hospital, right, they didn't wean me off the morphine, and they made me like an instant addict.
Well, of course they give you pills too,
right in the right in the hospital because I was watching that clock to get the nurse in to give me my next drip and stuff, which is a horrible feeling. It's
Well,
not
listen,
even
look, you need in a situation like that when you're in the hospital and you got pain.
yeah.
There was nothing wrong with treating pain. That's why the narcotics were invented.
Yeah. Well, the reason why I brought this up was I wasn't weaned off of it. So when I got home, I had 3 days of withdrawal, right?
They didn't give you any pain
No,
medication.
no. And it was and those 3 days were a nightmare. I'll never want to live through that again.
Well,
And it was all sweats and shakes and all of that. What you go
well, it's
through.
only 3 days. Thank God.
Thank God. No. Yeah. I'm just saying.
What was that show on TV with a guy? The son. It was a crazy show. It's still on, I think. Ruthless or something, not Ruthless. Shameless.
Shameless.
When the son used to chain addicts down in their one addict he chained down into the basement.
Yeah.
I don't know what the reason was. The guy kept coming around and stealing stuff at his house. He kept stealing stuff at his house, and he would catch him, and he'd come back and steal it again because the guy was stealing to buy drugs. So he said, "I'll fix this." He took him, brought him into the basement, and chained him for 3 days.
Yeah.
Over the weekend, he gave him food. The guy was vomiting all over the place. He gave him water, and then when he got up and he was withdrawn, he was so happy. The guy. He said, "Thank you very much." A week later, he shows up with 4 more people. They're going to pay you to chain him in your basement. What a weird show.
That's fantastic.
Is Barbara Schneider going on today?
Yes, she is. Yes,
Barbara
she is.
Schneider. She has the best. Mine sometimes are funny, but she is the most informative doctor that I know.
Yeah.
And she has her own theories, which are good theories. And we'd like to introduce Barbara Schneider. She's going to come on the show next.
Yep.
And keep an eye out for her. It's the same post, right? It's the same podcast.
Yeah. It's just we're connect and we're back to back on the radio on Sunday mornings. So
by the way, we never told them where we are.
Yeah, we're on WOBM FM. If you're here locally, otherwise you can catch us on podcasts on iTunes, Yahoo, everywhere really where fine podcasts are found.
I wanted to ask you, can we put this show on tomorrow morning? Is that possible?
It will be on tomorrow morning.
Oh, yeah, the reason why is because we got to get this information out about Medicare disadvantage as soon as possible. Because December 7th, if you have a Medicare Advantage, change it to Medicare.
Yeah,
because that's the open enrollment. And if you're thinking about changing it to Medicare Advantage from Medicare, don't.
Right.
That's my opinion. You can find us in Bricktown, 74 Brick Boulevard. You can give us a call at 732-262-0700. You can fax your, if you have an MRI or something and you got pain, you fax it to us. We'll go over and let you know if we can help you. You can get us at jaspermd.com.
That's right.
Google me. Find out about what's going on at the Jasper Spine Institute. You have anything to say, Tommy? Say goodbye over the thing. Say, thank you very much. Great show. Go ahead. Talking to that thing. Say goodbye.
Bye-bye.
All right, Tommy.
There he goes.
He's loosening up a little bit. Next time he's going to give his own show on something.
Right.
We're going to have a podcast for Tommy.